don't treat it.
Okay. So you have practically then the anamnesis, seeing the history of the patient,
Yep.
having digital and transrectal diagnostic,
Yep.
and 2 boxes ticked. So you say, okay, now starting treatment. What would the treatment be? Because I know that it's very special, and you are pioneering this, not just in KL, but in Asia altogether. I honestly don't even know in Europe many people doing it. So
Well, where I first heard about this and where I first was exposed was actually in Denmark, in Copenhagen. So they were doing it. They were already doing it at the time, but I think somehow they lost interest. They lost interest after a while because
they don't have enough male. Yeah.
And I think the problem is the clinicians themselves are not doing it. They got a physio to do it. This is something that a urologist has to do because you have to see how it benefits the patient. So I think that's where that link went off. And of course,
how did a physiotherapist?
It's because it's after all using an equipment and applying it on a certain part of the body to send shock waves into the perineum. That can technically be done by a therapist.
It's very often, for orthopedic.
That's the same thing as saying your nurse can stitch up the skin also, right? You don't need to be a doctor to do that.
Yeah.
It's the same thing. So anyway, so I think because of that so-called knowledge did not pick up, did not become well known, and people lost interest. But I found it interesting because I always believed that physical treatment had a role in medicine, which we forgot because of chemical treatments.
Yeah.
So physical treatments, once upon a time, very, very popular.
Again, I think we have to clarify this to the listeners. Physical treatment means anything where we are using anything like cutting, shockwave therapy, ultrasound,
even massages,
warm pack, cold therapy, whatever.